We are group 4 and we're going to be doing our ergonomics lab on Logan's sitting and working posture.
Before we do our patient interview, we're going to talk about part 1, the subjective screen of contraindications and precautions of joint mobilizations, which will include indications, contradictions, and precautions. Some indications of joint mobilizations would be pain management, tone reduction, joint nutrition for grades 1 through 4, hypomobility, increased range of motion, pain tolerance or tolerance for motion, tissue integrity, and directional need. Some precautions for joint mobilizations are hypermobility, prolonged steroid use, including corticosteroids, excessive pain, systemic diseases like rheumatoid arthritis, and cognitive impairments. Some contraindications for joint mobilizations include fracture, infection, DVT, bone disease, malignancy, and cognitive impairments.
Before we begin any hands-on treatment for your joint, I would like to ask you a few questions to make sure it's safe for you. Please let me know if anything applies to you. Have you had any recent fractures, dislocation, or surgeries in or near this joint?
No.
Do you have any history of bone conditions such as osteoporosis, bone infections, or cancer that affects your bones or joints?
No.
Have you ever been diagnosed with any joint or connective tissue disorders such as rheumatoid arthritis, ligament laxity, or hypermobility?
Yes.
What do you have?
Hypermobility.
Okay. Are you currently experiencing severe or worsening pain, swelling, inflammation, or signs of infection like redness or warmth around the joint?
No.
Do you have any neurological symptoms such as numbness, tingling, dizziness, or unexplained weakness?
No.
Have you been told by a healthcare provider that you have any circulatory or vascular conditions such as blood clots or compromised blood flow?
No.
Okay, thank you for answering those questions. Based on your response, we should still be able to move forward with joint mobilization today. Thank you.
Thanks.
Part 2 of our slideshow includes postural observations, impairments in body structure and function, workstation overhaul, and home exercise program. Postural observations include decreased lordotic curve in lumbar spine, arms outstretched, and crossed legs. Some of the impairments that we saw correlating with our postural observation is number 1, that decreased lordosis in the lumbar spine, which could be mainly due to weak lordotic extensors. Next, we saw that the participant had their arms outstretched in more of a rounded position, so this could be due to a tight pec minor and tight shoulder flexors. Next, we saw them having crossed legs in that crisscross position, so this could be due to tight hip flexors, overall reducing pelvic mobility. The overall adjustments we would make to the workstation would be number 1, adding a chair, specifically with lumbar support. The lumbar support will help reintroduce that lordotic curve into the lumbar spine, and next, overall having a chair will help bring those legs and hips into a more extended and comfortable position. Next would be adding a desk. This will allow for the decreased roundness of the shoulders, allowing for better ergonomics.
For the first impairment, it would be decreased lordosis in lumbar spine and lengthened lumbar extensors. For the exercise, that would include paraspinal strengthening for lordotic extension. For the dosage, it would be about 1 to 3 sets and about 10 to 15 reps daily. For the rationale, it would be weak paraspinals that will cause low back pain and will strengthen and begin to rebuild the lordotic curve. For the next impairment, we added tight pectoral muscles such as the pectoralis major and shoulder flexors such as the anterior deltoid. Due to prolonged sitting and reaching forward during the day can cause the pectoral muscles to shorten and a rounded posture. To address this impairment, I selected a doorway pectoral stretch as our exercise, held for 30 to 45 seconds for 2 to 3 sets daily. That will help improve pectoral flexibility, reduce forward shoulder posture, and decrease strain on the cervical and thoracic spine.
Our next impairment is going to be shortened hip flexors and decreased hip mobility. Due to Logan's posture while she is doing her work on her computer, she has her trunk flexion as well as her crisscross applesauce position on the legs, which is causing these hip flexors to be tightened as well as the decreased hip mobility. To improve this, we'll be doing a cobra stretch. To do the stretch, we're going to be laying down, facing down, and we're going to push up with our arms as far as you can, lifting our trunk and head up to the air. We're going to hold this position to 15 to 60 seconds, and we're going to do 2 to 4 reps. And we're going to be doing this exercise daily. This is going to help improve hip flexibility as well as stretch those hip flexors.